good? So Jay, you're going to start us off. And then you're going to introduce. Hey, Joe. I think you're welcome to come up if you like.
We know you're going to pull down the average here, but we're okay with that.
No. I was about to. But you're right. I think you're going to welcome everybody. Is that okay? Sure. This is Jay Wilson. So again, you're up just words of welcome, and then again, if you could bring her up after from now on, we moms.
Yes, man. Yep, you got it. Good afternoon. Good afternoon. So I said hello, everybody. I didn't say hello to my council president, Mildred Crump, who's sitting right there. How you doing? And my colleague over there, the mayor of Orange, Dwayne Warren, is over there as well. And we have a powerhouse up here, and right, powerhouse. And just want to thank first the governor and the first lady for coming here to University Hospital in Newark to talk about women's health. I want to welcome everybody here to University Hospital, the state's only public hospital. We're moving forward here at the hospital, just like Newark is moving forward as well. So this is an awesome opportunity for us all. Great for me as the mayor. Great for all of us here. It's an opportunity to empower the women in our community, particularly black and brown women in this city, specifically around maternal health, which is very, very, very important for us. We don't have the same outcomes, unfortunately, our families as other families, and these are opportunities to kind of fix and rectify some of those things and straighten it out a little bit. So I'm glad to be here, and I'm being followed today by somebody named Jay Wilson from Melanated Moms. Let me tell you something. I like it already. When they told me the title was Melanated Moms, I said that's what we need, right? So I appreciate that, and come on up here and let these people know who you are.
Good morning, everyone. A little more energy. Good morning.
Good morning.
Thank you. I'm so incredibly honored and excited to be here, to be able to share my story, and to also know that we're signing something into law that will benefit women that look like me. So please bear with me. My name is Jay Wilson. I am the founding president of Melanated Moms. I'm also the community health nurse for the Greater Newark Healthcare Coalition. I want to thank Governor and Lady Murphy for even asking me to be here. This is more than an honor. This is absolutely a privilege to be able to be a part of this monumental thing today. In the last 15 years, I've worked as a nurse, and my primary patient population I've served has always been the marginalized population, mainly because I want to serve people who look like me, who come from places I come from. and who benefit from things that I know that we need. Throughout my life, I have experienced this particular crisis from many angles. As a nurse and as a patient advocate, I've served in Albany and Washington, D.C., fighting for the different civil and healthcare bills that affect people in the different communities of color. My perception on this issue changed significantly, though, when I became a patient myself. The outcome of my previous 4 pregnancies resulted in 2 losses and 2 beautiful girls who are actually in the audience today. It's through them that I was strengthened to be an active leader in increasing the awareness of the maternal health crisis and using my voice inside and outside of the communities of color. When my journey to parenthood began, I felt very voiceless and invisible. As a young girl, I was on Medicaid. I thought I didn't have the right to ask questions. I thought the disconnection from accessing quality health care wasn't afforded to me because I was on Medicaid. I thought that was the norm. I soon discovered the biggest health disparity had nothing to do with my insurance. It had to do with the melanin in my skin. It was because of this that I became a nurse, and I was able to access quality health care and increase my own professional knowledge. But the biases towards my treatment was still very significant, and I felt just like that same 19-year-old girl that walked in the clinic in 2004. When I lost my previous pregnancies, it was due to the high blood pressure condition called preeclampsia. In my first pregnancy, I was told my only option was to terminate my pregnancy. I didn't know that I had any other option. I always wanted to listen to the physician, so I did as I was told. When I went into my second pregnancy, I lost that baby to a stillborn, again through preeclampsia. As I learned more about what this disease is, I found out it wasn't a singular issue. It wasn't something that I just faced. I found out 76% of the cases of preeclampsia actually happen to women of color, women that look like me, and that completely devastated me. I just remember thinking, how many other women are really getting this same story? How many other healthcare providers, nurses, other advocates are telling them that their only option is you have no option? So, because I'm kind of like a problem solver, I decided to do something about it. So what I did is I created this community of support for moms and women of color. I gave us voices. I showed us how to advocate for ourselves. I showed us how to show up and show out. And I created Melanated Moms. Through the Melanated Moms platform, I was extended this amazing opportunity with the Greater Newark Healthcare Coalition to work on this amazing initiative called the Healthy Women, Healthy Families program. This particular program literally serves the women that I have been trying to touch my entire life. It serves the women that look like me, that know what it feels like to be invisible. It gives us a face, it gives us a voice, it gives us hope, and I'm so excited that I'm actually a part of this. So I want to thank you for even extending this opportunity, not just to me, but to other women who look like me. Through the Healthy Women, Healthy Families program, we've engaged hundreds of women, and this grant has been all over the state of New Jersey, and the First Lady has made it her personal initiative to make sure that we makes sure that we have not just access to care, but to quality care. She literally cares about making a difference. That's rare. It's very, very rare to see someone take a personal stake in the lives of other people. This particular bill, it supports Medicaid covering doulas, which are these amazing, beautiful birth workers who literally devote themselves to our women to change their birthing outcomes. Through this bill, they've showed us the impact of the sound of our voices don't just live as a statistic on a piece of paper. I'm so proud to know that I'm counted as a member of the maternal community, and with this legislative bill underway, we know the work is not complete, but it's absolutely just begun right here in the state of New Jersey. I now can say that I'm a survivor of preeclampsia, and I now know that I'm able to give my two girls, Nadia and Ava, hope that their biggest health disparity does not have to be determined by the color of their skin. It's with my esteemed pleasure to now welcome First Lady Timmy Murphy. Thank you.
Good morning. It is beyond wonderful to be here with all of you today to celebrate the signing of these very vital pieces of legislation. Thank you, Jay Wilson. How about Jay Wilson? Come on, let's give Jay Wilson. And Nadia and Ava, nice to see you there. Thank you for your kind introduction and for all of your work that you have done advocating on behalf of mothers all around New Jersey. I am honored to have you here with us to tell your story. And to my friends and colleagues, Department of Human Services Commissioner Carol Johnson over here, Department of Health Commissioner Sharif El-Nahal, thank you for being with us, and thank you both for your attentiveness to this urgent concern. Today marks a special moment in the work we have done together to ensure equity in care among all residents of the wonderfully diverse state of New Jersey. And to Mayor Baraka, thank you for being here and for all of your support for the mothers and children of Newark. I hope that together we can continue to make their lives both happier and healthier. Thank you for being a partner and a leader. To our legislators in attendance, in particular, Senator Theresa Ruiz, Senator Nia Gill, Assemblywoman Angela Mcknight, Assemblywoman Eliana Pinto-Moran, Assemblywoman Cleo Tucker, Assemblywoman Shavonda Sumter, Assemblywoman Shanique Spate, and Senator Joe Cryan, I owe you a deep debt of gratitude. Thank you for all your leadership and your commitment to this. Earlier this year, I launched Nurture NJ, a statewide awareness campaign that seeks not only to reduce the state's high maternal and infant mortality rates, but to eliminate racial disparities. I have spent the last year and a half meeting with stakeholders across New Jersey, mothers, doulas, and others who have navigated pregnancy to understand the current conditions surrounding maternal and infant health in our state. Despite New Jersey's innovative healthcare network, our history of leadership in healthcare, and the promotion of smart public health policy, New Jersey currently ranks 45th out of 50th in the United States for maternal deaths. In short, this means that 37 women die on average for every 100,000 live births in New Jersey. For mothers and babies of color, the statistics are even worse. Within the first year of giving birth, Black women in New Jersey are 5 times greater than white women to die from maternal birth complications. Black babies are 3 times more likely than white babies to never see their first birthday. This is the widest racial disparity in the entire nation, and it is wholly unacceptable. New Jersey must do better by these women and children. I'm proud to say that through these actions today, we will. We can and we will make New Jersey the safest place to give birth in the United States of America. It is not just my hope, but it's my promise that our state's mothers will navigate their pregnancies with the confidence that they and their babies will both thrive in birth and in life. I believe that we have identified where our healthcare system leaves folks behind. Now it's time to get to work to fill those gaps. It is on us to make sure every voice is heard, and it is our job as leaders to ensure that every mother, every baby, and every family has the opportunity to thrive here in New Jersey. Thank you to all of you who gathered here for the work you have done to make today possible. It is now my enormous pleasure to introduce my husband, Governor Phil Murphy.
Good job. Thank you. Thank you, thank you. Good afternoon. Thank you, Tammy, for your introduction and for leading our administration's fight for healthy moms and babies. And last but not least, for our almost 25 years of marriage. So bless you. A really sad note, I want to say this up front, and brothers and sisters in labor may know this already, but ATU, Amalgamated Transit Union International President, a dear friend of mine and ours, Larry Hanley, passed away suddenly yesterday. Larry was an extraordinary leader, particularly on the bus side at NJ Transit. He was a leader in organized labor. He was an all-around great guy, an important advisor, and consigliere to me, and please keep Larry and his family in your prayers. Back to today's efforts. Thank you again, Jay Wilson. One more time for Jay. Thank you for sharing your story, for having your two extraordinary daughters with us today, and for your work. Yeah. Ladies, stand up and take a bow, please. And Jay, your story and your work through Melanated Moms and the Greater Newark Healthcare Coalition to help new moms and babies to healthy starts is deeply appreciated and invaluable. I have to give, there are a lot of shout outs. We could be here all afternoon, by the way. I want to make sure if you brought your lunch, you may want to dig in. I want to thank as well University Hospital, and generally, bless you, University Hospital, and specifically, and specifically to its acting CEO, who's done an extraordinary job, our dear friend and leader, Judy Persicelli. Judy, please stand up and take a bow. Yeah. This hospital, no one knows this more than Mayor Baraka. This hospital serves a critical healthcare mission here in Newark and throughout the North Jersey region. It is New Jersey's only public hospital. It is North Jersey's only level 1 trauma center. Judy, I know you have been front and center in helping to restore University Hospital to its place as a premier healthcare center, and I and all of us thank you for your enormous efforts. Mayor Baraka, it is great to be with you again. The last time we were together earlier this week in Newark, we were standing beside the so-called MTV moon person. You can't make that up. A little bit more gravity today, although the VMAs are coming to Newark on August 26th. That's pretty cool. As the mayor can attest, for many Newarkers, this is their hospital. And we are committed to working with him and his administration, with our partners in the legislature, and with community leaders and advocates, many of whom are here today, I might add, to ensure the health and vitality of this hospital, which plays such a huge role in the health and vitality of this city. While I am sad to lose Dr. Sharif Elnahal from our cabinet, I am proud that he will take the reins from Judy to lead the revival here at University Hospital, and I look forward to our continued partnership. Stand up, please. By the time I'm finished, each and every one of you will have the opportunity to stand and take a bow, I promise you. And one of those critical areas that Sharif will be focusing on in our partnership will be in ensuring that every baby born in New Jersey has a healthy start at life and that every mother will likewise be healthy so she can be there for her child throughout their life. And today I'm incredibly honored to sign not one, not two, not three, but 4 bills which will help us meet head-on our state's maternal and infant mortality crisis. And I am equally honored to be joined by an extraordinary team of legislators whose work on these measures has been invaluable, led by senators on the end, Senator Ruiz and Senator Cryan. Thank you on the Senate side. And Assemblywomen Ileana Penchmarin, Siobhan DeSumter, Cleopatra Tucker, Angela Mcknight, and Shanique Spike. Thank you all for your leadership. I would be remiss if I didn't acknowledge my president, Council President Mildred Crump. Mildred, if only you were our president. Mayor of Orange, again, he's been acknowledged, but a great friend, Dwayne Warren, is in the house. Bless you, buddy. And we're going to do, there's so many speakers, we're going to do the Q&A. I promise you I'll be available for Q&A. We're going to do it in the back of the room afterward. But in the meantime, Sister Pat Cody is keeping an eye on members of the press back there. So, Sister Pat, thank you. And from our cabinet, I want to reiterate acknowledging not just Sharif, but Human Services Commissioner Carol Johnson's with us. And, and a really important player, Lisa Asari, who we'll hear from later, Assistant Commissioner of Family Health at the Department of Health. And I got to give one more point of personal privilege. I got to give one more shout out to my wife, who has made maternal and infant health a key part of her work as First Lady, and who is at the forefront of our interagency and comprehensive Nurture NJ awareness initiative. The need for action could not be clearer. And as Tammy noted, in New Jersey, we've already got the statistics. The racial gaps are extraordinary and unacceptable, both for moms as well as for babies. In a state that is renowned for its leadership in healthcare, and a state that is among the very wealthiest in our nation, these disparities stand in stark contrast to our core values. By enacting these measures today, New Jersey is making a strong statement that every mother and every child counts. Today, we are improving access to vital perinatal care through Medicaid for qualified expectant mothers. Medicaid already covers 40% of all childbirths in New Jersey, and these measures will ensure that that coverage includes the time leading up to birth, as well as to help ensure a healthier outcome for both mother and child. We are also increasing access for Medicaid-eligible new mothers to doulas, who can play a critical role in reversing these statistics. And we are taking action to prohibit Medicaid and state-derived health plans from covering non-medically necessary induced births. We know these practices carry higher risks for mothers and babies who could greatly benefit from even a few more days in the womb, and they contribute to our being a national outlier in maternal and infant mortality. And we will not allow taxpayer dollars to support these practices anymore, period, full stop. This is interesting. We will not be the first state to stop paying for early deliveries, but we are joining a strikingly diverse group that includes, are you ready for this? Georgia, who'da thunk it? Michigan, New Mexico, New York, South Carolina, and Texas. An interesting group. It's very rare I give shout outs to Georgia, South Carolina, and Texas. So please make sure you have that on tape. Certainly, it will take more than these measures for us to get things right. We must also be unafraid to take on the systemic racism in our healthcare networks. To do so will require our changing the way we look at maternal health. We're not going to confine ourselves to looking only at the 9 months of pregnancy or the precious hours in the delivery room. We're going to focus on the years leading up to and following childbirth. When we have healthier communities, we have healthier mothers and babies. This is our ultimate goal through our actions today and our ongoing efforts through Nurture NJ. Once again, I congratulate everybody here on their work to pass these bills. It is now my distinct pleasure to hand the podium over and introduce one of the leaders in this effort and in so many other efforts in the legislature and in the Senate, Newark's own Senator Theresa Ruiz.
Thank you. Thank you. Thank you, and welcome to the greatest district in the Garden State, the great city of Newark, to our governor, to to the First Lady, to members of the Cabinet, and to the great mayor. So first, I just want to take an opportunity to say, let's celebrate the power of the body of the woman that has the opportunity to give birth and life to another individual. It is an extraordinary thing that we have, and then I'll walk you through some personal experiences, but I think that deserves a round of applause for every woman in the room. You've heard a lot of statistics, and so one of them, and I'm not sure if it was mentioned, but I'll repeat it, New Jersey ranked 43 out of the 48 states that were measured in this, and certainly New Jersey never wants to be in any capacity except in number one position. This whole range of policy initiatives is much greater than just having a quick fix. It's an approach to educate and empower both the women, our families, and our communities. We must do better in our medical school systems to train the next generation of professionals to understand their critical key component and having conversations that are not one-sided but inclusive of the mother who's about to give birth. We have to empower and educate the woman before giving birth, during giving birth, and give her all of the support systems in place. So I had a baby about 2.5 years ago, and even though I look like a spring chicken, I was in the geriatric pregnancy category. That happens after the age of 35. It is an official term, yes. I just did not coin that. Unfortunately, perhaps we should coin it something else, like, the wisdom years or something. I don't know. I reached out to a doula, and I had the opportunity to work alongside of her. I have an older sister. I texted Eliana and Shanique to no end every time that I felt something because I was afraid. I one day got a weird sensation on the bottom of my feet, and they were itchy, and I had the opportunity to text my OBGYN, who then said to me, you need to get down to the hospital right away. Here's something that I never knew. Pregnant women who have symptoms of itchy palms or itchy feet can be because of a liver enzyme that is secreted into the body that can create stillbirths. Who would have thunk it, right? I'm educated. I had a support system. I had a doula. I had a family provider. Fast forward to the day I'm giving birth. Because of the same symptom, she didn't want to take a risk, and she induced me. And after 26 hours, we realized that the Pitocin wasn't draining in properly, and that's why I wasn't dilating to the level. I say geriatric pregnancy because when you're in that caveat, it's very quick for someone to take a knife and open you under the guise that there could be a health risk posed to you. But I said, you better pump up that Pitocin because I am pushing no matter what. New Jersey is at the forefront of not joining other states, Governor. New Jersey is at the forefront of creating a paradigm of policy that people will follow. Earlier this week, or maybe last week, I don't remember the date, the governor signed the New Jersey Maternal Care Quality Collaborative. And that's really going to be the roadmap for all of us to follow, kind of where this policy will lend itself to touching human beings during that most critical time in their life. And it is so key that we're making this announcement right here at University Hospital. When we think about a woman giving birth to a new human being, the support system it needs, the opportunities of hope, the expectations for the future, those are the same critical alignments that we look here at University Hospital for its future. It is the only baby-friendly designated facility in the state that doesn't get touted enough. There are programs to encourage new mothers to breastfeed is extraordinary. And these are the things that you're going to see surface to the top as the headlines of negative press go away. We have a key opportunity here in the state, and it's twofold. That's to bring women to the fold, empower and educate them, to move from 43 to number 1, to create a paradigm that puts us in a category that people will say, I want to be like New Jersey, and to show the world that this public health institution will rise as a phoenix out of the many opportunities it's had under the new direction of the commissioner. Now, are you still the commissioner? Yes. Commissioner in flux. I'll give you new. You don't fall into the geriatric component yet. But to everyone who's made this a reality today, thank you. To everyone who works here at the hospital, thank you for your commitment and your hope and faith for the future. And to all of the future mothers, never be afraid to ask questions. Never be afraid to seek out help. Never be afraid to text a friend at 3 o'clock in the morning if you think something is wrong. Our intuition is critical, and we should only not rely on that, but as we move forward, I can guarantee you that the next generation of mothers will be more empowered and educated in securing a safe birthing process. Thank you.
All right, Senator. Great job. Great job. We're not going to hear from everybody up here in case you're wondering, but thank you, Senator Ruiz. And I'm just trying to calculate what year your daughter is going to be a member of the Harvard graduating class. So we have to bless her heart. We've got a couple of speakers representing the Assembly. It's my honor again to bring up Newark's own Assemblywoman, Ileana Pinter-Marin. Come on down.
So, good afternoon, everyone. Good afternoon. So, Senator Ruiz was right. She did text me for a lot of things every day. And we're glad that we have Shanique, which is a mom with much more experience. And I say that because, you know, in this light, it is important for us to ask questions. It is important for us to remember that we have friends that have been through it all. But it is also important for us to remember that our bodies are all different. Our bodies all react to different pregnancies in different ways. So not only should we call our friends, but we should make sure that we annoy our OBGYNs to death, because they want you to talk about what your symptoms are. And I will say that, you know, Senator Ruiz, you talk about that you had your child during the wisdom years, fabulous wisdom years. And I think that at times we're in a rush to kind of maybe have certain things go into order, but I think that if I was at a different age, I think that what I would have known then compared to what I knew would have been different. And I say this because we have experiences even in our own caucus room with women of color who have gone to hospitals, who have told us, you know what, they didn't really listen to me. My child was exhibiting XYZ. And it wasn't until I called someone else that was of a different race that they made me listen. They made them listen to what it was that I was talking about. It's important for us to remember that, because if for some reason your physician is not listening, you need to make sure that someone else will. And I want to talk to you about, you talked about your experience with regards to Medicaid. Well, this is why we're making sure that doulas will be able to be covered through Medicaid, because not all of us have the same support system that a lot of us here have. We might not have a support system at home, and we definitely might not have a support system after birth, which everyone always worries about. How's the baby? How is the baby doing? But I'll never forget the one important thing that my mom always used to ask is, how are you feeling? Because if you don't feel well, you can't take care of that baby. And if you don't have that other person, you need to make sure that your doula is there and that they know you and that they recognize symptoms that are off. And that's important. So I want to thank not only the First Lady, but the Governor for really understanding that women rule the world. I might get her in trouble, but we can do things better. We're smarter. But the most important thing is that we understand our bodies, and we need to make sure that someone else understands what our body is going through. So to all the women that have given birth here today, and I thank you, because only each woman who has done that understands exactly what Senator Ruiz says. Our bodies are powerful, so we need to make sure that we have physicians that understand how powerful our body really are. Thank you.
Thank you. Thank you, Ileana. I want to invite another Assemblywoman up, all the way in from Hudson County, a leader on this and so much else. Honored to have Angela Mcknight with us. Come on down, Angela.
Good afternoon. I want to say thank you to Governor. I want to say thank you to the First Lady, also Mayor Baraka, all the legislators. and the commissioners and everyone here that are assembled here. Thank you. I was just giving Assemblywoman Spate a hug because she was being emotional. She had gotten emotional. And I just want to share, and I just asked her right now if I can share. She has 4 children, and all 4 children were delivered by cesarean. So I know it's near and dear to her heart. And then when Eliana says that her mom used to ask her, how is she doing? My daughter is a first-time mom, and my grandson is 18 months. And every time we go out, everyone says, how is your son? And she says, well, what about me? So now, thank you, Eliana, for saying that. I'm going to begin to ask my daughter, how are you doing? I give greetings from the 31st District that I'm proud to serve. I also give greetings from the Assembly Women and Children Committee, in which I am the vice chair, and our chairwoman, Mascara, who is pregnant and is due to deliver her second baby any day now. Any day. First, let me say that it is encouraging to see the progress our state is making with maternal health initiatives that will lead to more positive outcomes for women and children. I am pleased to have worked with our caucus to develop and be prime sponsor of A 4935, which prohibits health coverage of certain scheduled C-sections, deliveries, or labor inductions without medical necessity under Medicaid. Many moms who choose to schedule early C-sections without a medical reason may not fully understand the risks involved. It is estimated that 1,700 babies in New Jersey are unnecessarily delivered early, putting them and their moms at risk and danger of otherwise preventable complications. New Jersey, as we know, is ranked close to 50. And we know that Black moms are more likely to die than women, white women. I'm so happy that Medicaid will now cover doulas so that underserved women can have more birthing support. The package of bills being signed today will help reduce these disparities. In closing, I would like to thank everyone here. Your work to help moms and children get the support that they need is crucial. Although we are making progress, we still need to do more in the state of New Jersey. And I'm proud to stand here with all of these legislators, as well as the First Lady, as well as the Governor, and as well as Jay. Thank you for sharing that story. Thank you. I'm proud to stand here today so that we can make sure that New Jersey becomes #1. Thank you.
Thank you so much. Angela, thank you. There's a fair amount of chatter back here on the grandson thing, which we're God bless you and thank you. To all of the legislators, again, extraordinary leadership on this. We're going to have 2 more folks who want to just say a quick word, and it's my honor to bring up one of the members of our cabinet, a woman who has led in this fight, but based on her federal experience and now her deep New Jersey experience, occupies an extraordinarily important role in our cabinet. It's the Commissioner of the Department of Human Services, Carol Johnson.
Good afternoon, everyone. Thank you so much for being here. I will be brief. I want to thank you, Governor. When my colleagues in other states ask me how New Jersey is moving so quickly on this issue, I say 3 things. 1, the Governor and the First Lady have made this a top priority and have said that the disparities that exist in our state are completely unacceptable, and addressing racism is part of the solution. 2, the powerhouse women in the New Jersey State Legislature and 3, the fierce, fierce advocates in our state. So a round of applause for you all. Without the combination of those 3 things, we wouldn't be here today. I run the Department of Human Services. As the Governor said, we run the Medicaid program. Today is a little bit of the passing of the baton. The legislature has laid out for us what the framework is for the policy changes that need to be made, and it's our job to implement them. We do that with a sense of urgency because we know how critical this problem is. But it's even more urgent given that yesterday CDC told us about half of pregnancy-related deaths are preventable. So we need to get to the task of preventing those deaths. And part of that is about what CDC tells us is we need to focus on a couple of things. One, the prenatal period, and that means health care for women across the lifespan. That means early access to family planning and managing chronic diseases, because a surprising number of preventable deaths, for pregnancy-related preventable deaths, are heart disease and stroke. That's why in Medicaid we've changed our policy to expand access to diabetes prevention, and why we have gotten rid of some of our barriers to getting tobacco cessation benefits, because having healthy pregnancies is part of living a healthy lifestyle. We've also, with the support of the legislature, expanded family planning benefits so that more women above traditional Medicaid eligibility categories can get access to family planning services, including long-acting reversible contraception, which we all know, everyone in this room knows, is one of the most effective forms of contraception. The CDC also tells us to focus on the delivery period. That's why we're so excited to be able to implement the doula legislation that the legislature has laid out, as well as the reducing early elective Cs policy and improving our risk screenings. And an important part of what CDC laid out was the importance of supporting women post-pregnancy. And that is not only about their health care, but that is about the social determinants of health, the things that ensure that women can live healthy lives that are all about the environments in which they live. And so that's why we as an administration have invested so heavily, and so many of the legislators here today are champions of our efforts to support affordable childcare, because affordable childcare is a part of a healthy life. And at the end of the day, so much of this is about economic opportunity. The research base is continuing to grow, showing that a minimum wage, a state earned income tax credit that improve economic opportunities and affect the birth weights of children and can improve maternal mortality. So we are together as a state fighting hard across all fronts, both in the healthcare sphere and in all those social determinants, to create the best possible environment for our families. Thank you so much.
Well done, Carol. Last but certainly not least, representing the Department of Health, its Assistant Commissioner and a leader in this entire arena and so many more. Please help me welcome Lisa Asare.
Thank you very much, Governor, for that introduction, and thanks for having me. What a great day. I just think it's great to be here at University Hospital and great to be here in the great city of Newark. So wonderful and welcome. I'm the last speaker, and I'm going to speak to you about some of our efforts in the Department of Health. But I think it's important for you to know who I am. I am a mother. I'm also an assistant commissioner, but I've had 3 children in New Jersey. One is 23, one is 19, and God decided to give me a bonus, and I became a geriatric pregnancy patient. I have a 10-year-old. But I say that because I think as a mother, the focus is always on our children. And I knew a lot about the stats around infant mortality and knew that certainly my kids were at great risk. But I had no idea about what was happening in maternal mortality. And now that I'm a mother and I have 2 daughters, it is my mission really to make sure that I take care of my grandchildren to come, but I certainly continue to ask my daughters how they're doing when they get to that stage. I had the benefit of having a mother that sort of flew in from across the world to be with me, so she was my doula, and I will say that she certainly made it her mission to constantly ask me how I was doing. We're from West Africa, so I think doula in Ghana is sort of like a mother or grandmother or aunt. But I think because of her comprehension of what happens to a lot of women in the early stages, she understood that this baby would be fine, but her baby, me, was the one that really needed to be looked after. So I've told you about who I am, but I will sort of refer back to Jay's comments about it's tragic when race determines your destiny. She has her 2 daughters here. I look at them and I think of my own, but we really have to do this work so that that is no longer our situation. Under the leadership of First Lady and the New Jersey Nurture NJ initiative, DOH is really working in concert through something called Healthy Women, Healthy Families. We are focused on high-risk women that include low-income or uninsured, women with chronic health conditions, victims of domestic violence, folks that are experiencing mental health issues, and just people in general who may have had unintended pregnancies or need additional social supports. And we really took our time when we developed this program to really canvass the state and really speak to women and speak to community health workers about what the barriers were and what some of their experiences were. And out of all of that state crisscross traveling and talking, we developed the Healthy Women, Healthy Families Initiative, and we've invested $4.3 million to address county initiatives as well as municipality initiatives that really focus on high-need cities and really use evidence-based practices that have been shown to be very successful and promising with communities of color. So I'm really happy to stand in front of you and see so many of my partners represented here. I see the doulas, I see the executive directors, I see the agency leads, I see the community health workers, and I'm absolutely thrilled to be here with them. You should know we're targeting these activities in 8 key cities. We hope to be in more places, and thanks to Carol and the work of DHS, Commissioner Johnson, we will have Medicaid coverage for doulas statewide. But currently we are targeting this work in Atlantic City, Camden, Trenton, East Orange, Irvington, Jersey City, Patterson, and of course this great city of Newark. Doulas and DOH, the initiatives are receiving a total of $450,000. $280,000 is going to SPAN, our statewide parent advocacy network. I see SPAN here. $120,000 is going to Children's Futures, and some money is also going to the Southern New Jersey Perinatal Cooperative. So where are we now in terms of our efforts? We launched this initiative about 9 months ago. I say again, 9 months ago. So, you know, it's this, the baby is here. The first baby is here. We have more to go. But I will tell you that we are very proud of our accomplishments to date. I personally stay up at night thinking about this, but we are really making advances. So we have hired 77 outreach workers, 40 doulas, 29 community health workers, and 8 community health worker supervisors. More than 11,000 women have been screened since July of last year. 8,500 have been connected to programs like home visiting, programs like Healthy Start, and of course, Healthy Families, Healthy Women. And most of these women reside in communities with high rates of Black infant mortality. 72 women are participating in the doula pilots, and to date, 25 have delivered with a doula. And the most exciting news is one of our community health worker leads is actually in labor today as we speak. So we're waiting for the news of that baby as well. But I just want to close and say this is our moment. Never at a time have I seen, I've been in the department for 20 years, and I have never seen this much attention around this issue. So this is really our moment. We have the best champions that we could ask for, a governor and first lady who are behind us. And really push our efforts forward. So let's continue in this vein. Thank you so very much.
Thank you, Lisa. Tammy reminds me that this whole space is captured in what are called family festivals. And they've held them so far in Camden, Trenton, and Patterson. Newark is next, Mayor. June 8th, the family festival comes to Newark on June 8th. So we're looking forward to seeing you all out there. I want to thank, in the bigger sense, our host, the one, the only, the rockin' Mayor Raz Baraka. I want to thank, amen. I want to thank our literal host, Judy Persicelli, and thank you again for your extraordinary leadership and your whole team. Wish Sharif the very best. I want to thank this murderer's row of legislators, without whom we wouldn't be here. To the Commissioner Johnson, to Lisa, to Jay. Thank you, Jay, for your extraordinary leadership and your great story, your daughters. Thank you, Lisa and Carol, for your leadership. Mrs. Murphy, great leadership by you as well. Madam President, Mayor, Sister, all of the above. Bless you all. Let's go over and make this the law of the land.